Can imaging help identify your rheumatoid arthritis flare? Have you ever wondered if imaging can help you understand your rheumatoid arthritis flares better? The answer is yes. Imaging techniques like magnetic resonance imaging and musculoskeletal ultrasound can play a significant role in identifying and assessing these flares. They can detect inflammation and changes in your joints that might not be obvious during a physical examination. Both magnetic resonance imaging and musculoskeletal ultrasound are sensitive tools that can reveal active inflammation. This includes conditions like synovitis, which is inflammation of the joint lining, and tenosynovitis, which affects the tendon sheaths. They can also show bone marrow edema, a sign of active inflammation that can lead to bone erosion and early bone damage. These features are crucial for understanding what is happening during a raw flare. Magnetic resonance imaging is particularly useful because it provides detailed images of both bone and soft tissues without using radiation. It can identify joint effusions, synovitis, tenosynovitis, and even cartilage damage. Bone marrow edema visible on magnetic resonance imaging is especially important as it indicates active inflammation and may predict future joint damage. Additionally, magnetic resonance imaging can assess inflammatory changes in the spine, which can be a complication of rheumatoid arthritis. Musculoskeletal ultrasound is another valuable tool. It is highly sensitive for detecting synovitis and tenosynovitis and can be used repeatedly to monitor disease activity and treatment response. Ultrasound can often detect inflammation earlier than X-rays can, making it a great option for guiding clinical decisions during flare management. While X-rays can be helpful for tracking long-term joint damage, they are less effective in identifying early or active disease. In fact, X-rays may appear normal during flares, which is why magnetic resonance imaging and ultrasound are often more effective for spotting active inflammation. However, it is essential to remember that imaging findings should be interpreted alongside clinical examinations, patient history, and laboratory tests. Some changes seen in imaging can also occur in other rheumatic diseases or even in people who do not have symptoms. Therefore, imaging supports clinical judgment but does not replace it. In practical terms, imaging can help rheumatologists confirm the presence of a flare, assess its severity, and monitor how well treatments are working. This information can guide adjustments in therapy to help prevent joint damage. In summary, advanced imaging techniques like magnetic resonance imaging and ultrasound are valuable tools that can help identify and characterize rheumatoid arthritis flares more accurately than physical exams or X-rays alone. This aids in timely and effective flare management. Always consult with your healthcare professional to understand how imaging can fit into your overall care plan.